So autojuvenation is this concept I came up with because as a plastic surgeon, I told you I thought I hit the pinnacle of success. I was doing facelifts on people who were traveling all across the country. I had a wait list of over a year and a half, and it got to the point where I really relooked at my practice and I started wondering, like, am I doing the right thing? Is this
Mhm.
the right job for me? And it came down to was me really taking time to research for many years, books and literature and stuff that I was never exposed to in medical school or in my training, and trying to find out, can I get people to look the way they want to look, to turn back the clock naturally? And that's what came up with the whole process of autojuvenation.
Known as America's holistic plastic surgeon, Dr. Anthony Youn is a nationally recognized board certified plastic surgeon. Recognized as a leader in his field, he's the author of the best selling books The Age Fix, In Stitches, and Playing God. His public television special, The Age Fix with Dr. Anthony Youn, has been viewed by millions. Dr. Youn also hosts the popular podcast, The Holistic Plastic Surgery Show. He's the most followed plastic surgeon on social media with over 4.5 million subscribers on his YouTube channel, 8 million followers on TikTok, and his new book, Younger for Life, is a complete holistic guide to turning back the clock using the process of autojuvenation. All right, Tony. I'm like, it sounds so unprofessional. Dr. Youn, Tony, welcome to the show. I'm so excited to have you. I'm so excited about your new book, and it's just a pleasure to talk to you. We have been really orbiting one another for such
Yeah.
a long time, and I've never had a plastic surgeon on the show before, especially never even heard of a holistic plastic surgeon. So I'm excited kind of to dive in with you and how you've gotten to where you are today. So thank you for being here and donating your time.
Thank you, Kelly. No, I appreciate it. It's definitely a pleasure to join you here. And yes, I am well aware of the fact that you do not have plastic surgeons on your show because most plastic surgeons are about supporting and kind of pushing plastic surgery, the plastic surgery agenda. And that was something that, in my training, that was something that I was taught. As surgeons, you're trained to cut is to cure. Or you're also trained that the bigger the operation, the more prestigious it is. So when we go through our training, and let's say we're general surgeons going through the training, the thing you want to scrub in on, the surgery you want to do is the Whipple. The Whipple is like a 10-hour cancer operation. And if you're so lucky to scrub into that, you're at the top of the heap. And so I became a board certified plastic surgeon. I went through all my training and everything. And I got into private practice and I was taught the same thing of like, okay, where my prestige, where I get my I guess how I feel good about myself in some ways was how many facelifts I was performing because
Sure.
the Whipple is like the king of the general surgery procedures, and in plastic surgery, it was a facelift.
Hmm.
And I realized after I had a terrible complication for a patient, one that I could not have ever avoided, it just happens that the goal of bringing somebody to the operating room that should not be the goal of a plastic surgeon. It should be the opposite. It should be, how do you keep people out of the operating room? And from that point on, I really dedicated my career of like, how am I going to do this? How can I get people to feel great about themselves and to feel great about how they look without having to tell them that they need to go under the knife for it?
Right. I think people don't even think that complications can arise when they're having elective surgeries. They're not really down that rabbit hole. They're just so excited about the
Mhm.
facelift or the breast augmentation or the rhinoplasty that they aren't really thinking about the what ifs. When it comes to plastic surgery or surgery in general, like how often is there kind of those unintended side effects or problems?
It occurs more commonly than you may think. Now, if somebody asks me, Dr. Yoon, if I have this operation, if I go under a general anesthesia and let's say get a tummy tuck, what's the worst thing that can happen to me? You always have to tell them you can die. Like that's the worst thing that can happen. And it happens, not
Yeah.
commonly, but
Yeah.
it does happen. More commonly, though, if you look at just regular complications, ones that are more than just like itching or a little bit irritation or something like that,
Mhm.
depending on the operation, that can be very, very high. If you look at, let's say, breast implant surgery, 1 out of 3 women who undergo breast augmentation will undergo a second operation within the first 10 years of their first operation. That's 1 out of every 3. And
Mhm.
implants are not permanent devices. So you need to have more operations after that, even if you're not in that 1/3 in the first 10 years. So this is something where really plastic surgery should always be considered as a last resort, and
Mhm.
that's one of the things that I really, really try to encourage people is don't jump to plastic surgery. There is so much that you can do before you get to that drastic point that you can help yourself to look and feel better.
Right. And you bring up an important point. I mean, I know that people getting a breast augmentation are told, you should get this redone multiple times, especially if you're getting it done young. And I've had clients that I've worked with in the nutrition space who've had symptoms and come to find out they've had their breast implants in for close to 17 years and they've never touched them. And then we've gone to the point where some have gone through explant surgeries
Yeah.
to relieve symptoms that are kind of coming back to breast implant illness.
Yeah.
How often are people coming to you for explants, and how do you feel about breast implants?
So I do a lot of explants. I actually just did one yesterday. This is interesting because the dogma, so silicone implants, basically, the history of them is that there was in the early 90s, late 80s, this big hubbub because a lot of women thought that their implants were making them sick. And so in 1992, the FDA put a moratorium on silicone implants. Dow Chemical went bankrupt, and it was kind of a big class action, a big deal.
Hmm.
For literally like 15 years or so, silicone implants were not on the market. They were put in an FDA approval study. And then in 2006, the FDA put them back on the market again. And this basically, a lot of plastic surgeons consider that then to be validation that implants are safe. And as a plastic surgeon training back in the early 2000s, that was the dogma. That's what I was always taught was, oh yeah, breast implants don't cause systemic illness. They're completely safe. And I believe that up until many years ago, where I started getting patients who would come to see me and say, Dr. Youn, I've got these weird symptoms and stuff, and I've been online, and there are these message boards and websites of people talking about breast implant illness.
Hmm.
So, like any good doctor, I said, look, this is what I was taught, but let me do some more research into this. And instead of looking at the articles written by plastic surgeons in the plastic surgery literature, I started looking for articles written by rheumatologists and other types of physicians. And lo and behold, there are articles talking about how implants being removed from patients made their systemic symptoms better. And the studies show anywhere from about 55 to 80% of women who have symptoms that are autoimmune related, brain fog, rashes, joint pain, hair loss, all of that, 55 to 80% of them seem to improve when their implants are removed. And so many years ago, I was one of the first plastic surgeons to actually come out and say, hey, look, I think there's something here. I think we really need to look at this. And I believe breast implant illness is real. And you know what? I had plastic surgeons very, very upset with me. I had people calling me saying, you can't say this. What do you think you're doing? And
Hmm.
really, what it comes down to is people are profit minded. Breast augmentation is the number one cosmetic plastic surgery being performed. There are some doctors that's all they do in their practice, making millions of dollars. And a lot of the people who are doing the breast implant studies are paid by the breast implant companies. And
Hmm.
so it's a big deal. I believe myself that not everybody gets sick from implants. There's
Hmm.
those plastic surgeons who will tell patients literally, a woman will come in, they'll say, I've got implants, I've got all these symptoms. And they'll say, well, you got to go see a psychiatrist. Literally, doctors will do that. And then
Hmm.
on the other end, there are women who say, look, everybody gets sick from implants. They're toxic. Nobody should do them. And for me, as a plastic surgeon who's done this for 20 years, I feel like most things in life, the truth is somewhere in the middle.
Right.
I think that it's real. I think some people get sick from their implants, but I don't think everybody does. I know
Hmm.
healthcare influencers who have breast implants, holistic healthcare influencers who are perfectly healthy. We just don't know. And we have to, learn more about it. But always, always, we have to trust our patients that they know what's going on with their bodies.
I mean, it's so refreshing to hear a physician say that because a lot of times just that validation that you know best about your body and having the informed consent and a physician say, "Oh, this is what I've seen in my patient population. Certain percentage of people do have symptoms with breast augmentation, a certain percent don't. You're going to have to, either take that risk or decide not to." I love that you are promoting you're a plastic surgeon promoting just the holistic health aspect and taking care of ourselves and all the other things that we can do to keep ourselves off the table. I when I think about plastic surgery, I think about breast augmentation. We talked about that. I think about rhinoplasty or a nose job. I think about all of these tremendous weight loss challenges or people who've lost,
Mhm.
especially looking through the COVID years and post these amazing transformations where people have lost multiple pounds that have resulted in sort of sagging or thin skin, and then they end up getting a skin tightening type of surgeries where
Mhm.
they're removing some extra skin. Can you talk a little bit about the skin removal type of a surgery, what side effects that might have, and what suggestions you have for patients when they've undergone these massive transformations?
Yeah, so really, you look at plastic surgery, and one of the big things, once again, for me is like, okay, how do we use plastic surgery only as a last resort? How do we
Mhm,
get people happy with their appearance without going under the knife? And for the most part, we can do that using a lot of the natural things that we'll talk about in a little bit. But there are those groups of people where, unfortunately, if you've lost 100 pounds and you've got skin hanging from your tummy, there's no food that you eat that's going to make that skin go away. There's no chemical peel that's going to make it disappear. Injections aren't going to do anything, and non-invasive treatments won't either. So the one group of people where really surgery is your only true, really effective option is when you've got a lot of excess skin, whether
mhm,
that's in your tummy, the breasts, the arms, the eyelids, the neck. Really, that's where really surgery comes in. And the big thing you have to keep in mind when you're talking about removing or cutting out skin is that it creates scars. So if
mhm,
you do a facelift, you're cutting out excess skin from the lower face and the neck, it creates scars around the ears. You do a breast lift, you remove excess skin from the breasts when the breasts are really droopy, that creates a lot of scars on the breasts. And the same thing with the tummy tuck, with thigh lifts, all of them entail lengthy scars. And whenever you are creating scars that are that long, there's always a potential risk of wound healing problems as well. And so
mhm,
being really mindful of nutrition
mhm,
and making sure that you are eating nutritious foods, that you have enough protein on board. And actually, all my patients, I spent many years working on an actual pre and post surgical supplement protocol. And interesting, I looked at the research that was done in traditional surgical medicine, which was typically in trauma patients and ICU patients, patients who had traumatic brain injuries and they had pressure sores, or who had, let's say, quadriplegia and they had issues with healing wounds and stuff like that. And I combined that with a lot of the holistic literature that I read about gut health, microbiome, and all that. And I created this supplement protocol that I feel has been really helpful for my patients. And interestingly, I created this like 7, 8 years ago. Now there are a couple of companies that have come out with their own nutritional protocol for people before and after surgery. And it mirrors mine, even though I never actually put mine out there. So I think I was onto something. But nutrition is huge. And that's one thing that they do not treat us in medical school or teach us in medical school.
right.
Really, for the first like 10 years of my career, patients would say, "Hey, what do you think I should eat or supplements I should take?" And my recommendation to them was what I learned is just go off everything and just eat your regular diet. And it's like, no, I was giving bad advice back then. And I guess I know a little better now.
Well, I love that you were a physician who's curious enough to when your patients came to you with questions or concerns or anything like that, that you really did your research and due diligence when it came to how you could support them. It is true. Most of the time when anyone's going into surgery, the number one thing that you'll hear is, please get off your omega-3s because they're blood thinning.
Yeah.
And you're like,
Yeah.
okay.
Yeah.
But
Stop
like,
smoking.
how
Okay. Yeah.
about all of the healing that needs to happen, and how do I prevent scars, and how do I ensure, that I have enough amino acids and collagen present in my
Exactly.
body, and the vitamin C needed to synthesize that, and I'm sure those are included. So what are some of your favorite nutrients going in and out of surgery?
Yeah, so going into surgery, big thing is protein. So one of the
Mhm,
things that happens with if you have major surgery is that you oftentimes will stop eating for a few days afterwards because you lose your appetite. Your
mhm,
body starts to undergo actually breakdown of skeletal muscle. And so one of the things that we get our patients is we get them on essential amino acids and we encourage them to eat a lot of protein. The second thing is arginine. Arginine is interesting. It's a protein that a lot of studies have looked at with wound healing seems to be very helpful. So we get patients started on arginine as well as the amino acids, usually 2 weeks before surgery. And then the other thing that I think is great is to take a daily probiotic. Most patients who have surgery, they're put on an antibiotic. That can, as we know, it can really disrupt your gut flora. And so getting started on a probiotic before you start the antibiotics is what we usually do. And then on top of that, we do recommend herbals like arnica and bromelain. Those we usually will start right after surgery. The idea is to reduce inflammation. That may help to reduce swelling, get them healing a little faster. And then 2 weeks after surgery, we will start them on the omega 3s so that they can reduce inflammation You don't want to start that because you don't want to increase bleeding, so you don't start that too early. But when you get past that 2 weeks, which is when you really the risk of bleeding is pretty much zero after that, then we get them started on those omega threes.
So now we're getting a taste that you are actually a holistic plastic surgeon, where you're giving people advice around their surgical time, around that surgery itself. But I think what I love the most is you're trying to keep people off the table. And in your new book, Younger for Life, you go through how we can do that, a guide to keeping people out of your office, feeling good about themselves. And you talk a lot about something called autojuvenation. And I'm curious, if you could walk us through what is autojuvenation? What is it doing? How do we make it happen in our own bodies so we don't need to come knocking on your door?
Thank you. Yeah. So autojuvenation is this concept I came up with because as a plastic surgeon, I told you I thought I hit the pinnacle of success. I was doing facelifts on people who were traveling all across the country. I had a wait list of over a year and a half, and I had a patient who had a horrible complication. And it got to the point where I really relooked at my practice and I started wondering, like, am I doing the right thing? Is this
Mhm.
the right job for me? And should I quit being a plastic surgeon altogether? And it really, I spent months where I agonized over this. And I thought, am I doing a disservice to all these thousands of people that I've treated? And it came down to was me really taking time to research for many years books and literature and stuff that I was never exposed to in medical school or in my training, and trying to find out, can I get people to look the way they want to look, to turn back the clock naturally? And that's what came up with the whole process of autojuvenation. So autojuvenation basically is a way to use your body's own regenerative abilities to turn back the clock, to get better skin, to get more energy, to feel better about yourself. And it entails what you eat, when you eat, it entails nutritional supplements, skincare products, and then lifestyle modifications. And if you want to add some non invasive treatments, that can even up that level for you as well.
We got to go through it all then.
Yes.
But they'll get your book, of course.
Yeah, I'm happy to share everything. Yeah.
So let's talk about the what and the when it comes to food and what you suggest for turning back the clock on aging.
So, as far as what to eat, the first thing you want to look at is why does our skin age? And I would argue that there are four major factors that, for me, I try to focus on with skin aging. The first factor is collagen degradation. Our skin loses collagen. So, every year, after about the age of 25 or so, we lose about 1% of the thickness of our collagen every year. Women, once they go through menopause, that increases about 2% a year. And that's why you may see some women who are in their 70s and their skin is tissue paper thin.
Mhm.
And so, one of the big things we want to do is fight that collagen degradation. The second cause of aging of our skin that I like to focus on is oxidation or free radicals. Okay.
Mhm.
And we fight oxidation or free radicals with antioxidants. The third cause of skin aging that we want to focus on is chronic inflammation. And sugar is a huge component with chronic inflammation. And then the fourth thing that can cause our skin to age prematurely is a buildup of cellular waste. Now,
Mhm.
our cells will build up with this waste products, or used organelles and proteins and waste products that if you do not clean those cells out of it, the cells don't function as efficiently. And the way to clean it is a process that you've talked about on this podcast before. I know Dr. Hyman, autophagy, and it's
Mhm.
a term that we call that stands for self-eating, but essentially a recycling of the cellular waste products of the cell. And you don't get autophagy going unless, in general, you stop eating for a while. So those are
Mhm.
kind of the four things that we focus on. And interestingly enough, food impacts all four of those. And that's why, when people look at how do you reverse aging naturally, how do you slow down the aging process, the way I describe it, it's like you're building a house. And some people think, well, I want to look younger. Shouldn't I get a facelift? Well, the facelift is going to be like the top, the spire at the house, or um, the chimney,
Yeah.
and the foundation of the house is what you eat, and that's what you always want to start with.
That makes perfect sense. So when it comes to collagen degradation and fighting that, what are some foods that you like people to supplement with? Are you supplementing with collagen peptides? Are you supplementing with other types of proteins? What's your favorite?
So first thing is we always have to realize, and this is something you've taught before, is you cannot supplement yourself out of a bad diet. And
Yep.
you got to keep in mind that collagen is a protein. It's a large protein. And the first thing you want to do is make sure you eat enough protein. Like you said on your podcast before, there's this idea that in order to age better, you have to eat less protein. And
Hmm.
there are some, studies that will argue that for longevity, that less protein can be potentially helpful, but that's obviously an argument still that's being made.
Hmm.
So the first thing you want to look at, though, is collagen as a protein, and you need to get sufficient protein in your diet to support that collagen. And healthy sources of protein, which would be ideally pasture, grass-fed, or wild-caught meats, are the first place to start. Obviously, if you're plant-based, then that's not an option for you. So you want to look at nuts and seeds and legumes and all of that. Now, as far
Hmm.
as supplements, I am a big proponent of collagen supplements. Collagen supplements are very controversial.
Hmm.
And I have had people go online and bash me because I am a proponent of collagen supplements. And the
Hmm.
argument is that it's a huge protein, it gets broken down in your stomach. How do you know it's even going to work? Well,
Hmm.
really, what do? Let's look at the science. Let's look at what the studies show. And
Hmm.
there was a meta-analysis in 2021 and 2021 of 1,200 people. They took
Hmm.
of 90 for them, this 1,200 people took 90 days worth of hydrolyzed collagen supplements and found a statistically significant improvement in wrinkles, in skin hydration, and skin elasticity. 1,200 people, meta-analysis, statistically significant. There have been prospective randomized clinical trials of people taking 2 months of collagen supplements and actually biopsy their skin afterwards and found the skin to be thicker, the collagen content in the skin to be increased when they're taking a collagen supplement. But the key with the collagen supplement is you just don't want to take any collagen supplement. You want to make sure it's made with hydrolyzed collagen peptides. And the
Hmm.
reason why that's important is because it's such a huge protein, hydrolyzed collagen peptides basically is when that protein has been broken down into either single amino acids or peptides, which are a combination of a few amino acids, making it small and easy to digest. That
Hmm.
really is the key.
Great tip. I love it. And I love the meta-analysis mentioned because I think that's exactly what happens. It's either show me the research, someone saying how do we know it's actually working? We're not throwing money away, or you'll get the counter argument that you shouldn't be taking anything that isn't a complete amino acid because it doesn't have enough leucine to create muscle synthesis and it's not, going to calm hunger in the same way. But if you're taking collagen as a beauty supplement, and as a skin supplement, a joint supplement, I know it was really amazing for me throughout all my pregnancies and the healing,
Mhm.
throughout the stretching of my body and the healing of my body. It's always kind of been in my routine. So I love to hear that.
It's interesting because there was actually a cardiologist who's actually a traditionally trained cardiologist who has also done a bunch of nutrition stuff, and he's got a huge platform on TikTok. And
Hmm.
he made a video saying that collagen supplements are basically they don't work. There's no science to support them. You might as well just go buy Jello because and get gelatin at the store, and that's going to do the exact same thing. And interesting, and I thought, I disagree with him, but I'm not going to argue with him. And literally about 2 weeks ago, I found a video of his surfaced on my For You page on TikTok. And he showed his first video and he said, I was wrong.
Wow.
Collagen works. I looked at the science and collagen does work. And this is a guy, he's like got a huge, big, white, bushy beard. He's very matter of fact, like, he's like a professor type. Like, it's not like, hey, I think that this may be the case. He states everything with fact. And so when he stated the fact that collagen doesn't work, just take gelatin, go buy some Jello. You know, he says it with such
Conviction.
confidence, yeah, and conviction. And then here he comes, and he actually admitted he was wrong. And I thought, dang, that science must be really strong for him to
Uh,
say he was wrong about collagen.
right.
But it is. Now, the interesting thing, and we haven't brought up yet, is bone broth. And I know
Mhm.
you're a fan of bone broth like I am. I have a good friend of ours, and do you know Kellyanne Petrucci?
Yeah.
Yeah, so Kellyanne's a huge fan of bone broth, loves it for her skin. She's one of my dear friends. The science behind bone broth in the skin, however, that is not there yet. And
Yeah.
that's one thing that's interesting is, we know bone broth is chock full of collagen, but there aren't any studies to show that bone broth improves the skin. But there aren't any studies to show it doesn't improve the skin. So that's one that's interesting that there just aren't any studies on it.
Yeah.
And so being upfront and honest, there are a lot of studies on collagen supplements, no studies I know of on bone broth, but I would recommend both.
Yeah, I mean, I feel like it's when you look at study design and all of that, it makes sense that it would be easy to use a hydrolyzed collagen peptide to study and exactly know the dosage for each
Mhm.
patient and then really test the before and afters. Whereas when you get into bone broth, you're going to get into the nuances of like, where is this coming from? How long is it being, boiled or stewed down? How much is the collagen content in there? Yeah, there's a lot of things that play there. So it makes sense to enjoy it if you like it and make traditionally made like soups or stews. Like I made chili for my family last night. We love it with bone broth. It's such a rich, like a more rich flavor.
Mhm.
But I totally agree with you. Okay, so we've got the collagen down. Oxidative stress in the skin. I think about my Croatian like heritage, or I guess my mom's mom was from Croatia, and I have what I guess you would call them like olive spots or sunspots. They look like my grandma's hands, if I'm being totally honest. Probably should be wearing sunscreen more on my hands. But, that to me is an example of oxidative stress that I can physically see with my
Mhm.
eyes, and fighting that through antioxidants. So, what are some of your favorite ways and for people to plate things that would fight off that oxidation in the skin?
Yeah, and interestingly, a lot of the things that you have brought up, with your teachings, that's healthy for the gut, for your overall health, that's going to be the same thing for the skin. So it's really eating the rainbow of fruits and vegetables because we know that the actual antioxidants are in the pigment of those
Mhm,
fruits and vegetables. And so that's a huge part of it. The other thing that a lot of people don't realize when you're talking about oxidation and free radicals is that processed foods, ultra processed foods especially, will they contain free radicals, and
mhm.
we know that free radicals will attack our bodies, they will damage our DNA, and so reducing the amount of ultra processed foods is super super helpful, more so than just for the sugar and the bad fats, but actual oxidative processes is super important. And then fried foods as well, something to stay away from ideally, because that's the other thing that can also, frying foods, especially deep frying, can increase the free radical content of those foods. So
Right.
substituting that for the rainbow fruits and vegetables. One thing we do know too with vitamin C, especially, that's the most popular antioxidant, is it degrades very quickly after food is harvested. And so, getting food from a farmer's market that's been harvested very recently, you're going to get the most of that vitamin C. And one of the things we talk a lot about in holistic medicine is that we say the soil is not as good as it used to be, so that our fruits and vegetables aren't as nutritious as they used to be. And people say, well, where's the evidence for that? And there actually was a study that looked at it, a study from 1950 to 1999, where they looked at different fruits and vegetables and they monitored the nutrition content of each of these fruits and vegetables over 49 years. And they found that the amounts of at least six nutrients were gradually reduced every single year, pretty much. And those six include protein, iron, and vitamin C. And so another reason why, you can't supplement yourself out of a bad diet, but once again, supplements can definitely be helpful, especially with the farming practices nowadays.
Absolutely. I remember when I was writing my second book talking about a study on broccoli that looked at a week post being picked that the vitamin C content was actually at 0
Oh,
and
wow.
or negligible. So it was like pretty shocking to me personally and got me into buying flash frozen broccoli
Mhm.
when I couldn't get my hands on anything fresh or I didn't know where it was coming from, which is also a really great tip for saving money on getting some veggies in your kids or family's life. And your point of the highly processed foods and the degraded oils, we know H&E production from oxidized oils, especially those industrial seed oils, can really create an inflammatory state in the body. And that takes us to your next point, that chronic inflammation. So, removing the processed foods and sugar is what you mentioned when we first talked about it. How are you? I don't want to say having your cake and eating it too, but like, what do you enjoy in, or recommend to people if they're looking for a little something sweet without that hit of chronic inflammation?
So for me, I am one for some type of a moderation with that. I mean, I've got kids who are high school age kids, and they have games and practices, and they have parties and stuff like that. So for me, what I am not an absolutist, and so you will see me occasionally indulge in something, but I think that really what it comes down to is when you've got your body that is clean and you're not typically eating that stuff. I see that with my kids all the time is they have friends of theirs who will be eating fast food a lot. And I asked my son, like, why didn't you eat it with them? And he goes, because I know if I eat that, I'm going to feel terrible. Every
Mhm.
once in a while, you've got a child who's having a birthday party and they feel bad if you don't eat the cake, then you just eat the cake.
Yeah.
I'm okay with that. But really, I think it's trying to pick and choose those times because you do have to live as well. My followers are a little different than yours in that they're not maybe quite as educated in holistic health as your followers may be. And so for me, what I try to do, at least with what I put out there on social media, is I encourage people to try to take baby steps.
Yeah.
I have followers of mine that they drink 3 cans of soda pop a day. And it's like,
Mhm.
you know what? If you just take one of them out and switch it with green tea, that's great. It's a
Yeah.
great place to start. And that's part of the book too, is it's trying to encourage people that you don't have to be all or nothing. You can take small steps there, and those small steps can be, nice wins for you.
I really appreciate you saying that, Tony, and giving us a little insight into your real life because when I bring experts on the show, we as listeners or as the interviewer may assume that it's quote unquote perfect in your house and you've got it down and you know the science so you apply it perfectly and I think recognizing symptoms like your son saying if I ate that I would feel horrible somewhere along the line there you modeled behavior of eating healthy food and your children got to see that they also got to see you eat that cake at the birthday party and they're learning how to make those decisions for themselves along with the people that follow along on your YouTube and on all your channels. It's so important for people to know that it's not about perfection. I actually feel like when I work with clients privately on their nutrition, when there is this level of perfection that needs to happen with food, it really
Yes.
shoots us in the foot in regards to growth. And it is those small little changes. Okay, you're drinking 3 sodas a day. Can we replace it before we remove it? Maybe you can try Zevia instead, and then eventually sparkling water or green tea or whatever it is that you know moves the needle for them. Because if we can make it a habit and it can go smoothly, less likely that they're quote unquote falling off the wagon or getting to a place where it's a binge and then really strict rules or going for that perfection because it's that's not real life.
And in our society, it makes it so, so difficult. I mean, especially when you have kids and they're having a pizza party, and it's like, what are you going to do? Have your kid be the only one that doesn't eat that? I mean, obviously, if they've got celiac and stuff like that, that's one thing, but it
Mhm.
does make it difficult. And I think that with everything, we're always striving to be better, but at the same time, not beating ourselves up if we're not perfect. Like nobody is, and we shouldn't expect ourselves to be. And so it's really just taking small steps to be the people that we want to be is what I try to encourage people to do.
I love it. I mean, I will say as a mom with 3 kids under 5, we're dealing with the Halloween parties coming up right
Yeah.
now, and it's like you don't wanna take the candy off the table in the Halloween party, but I was surprised, a lot of the moms are on the same page as me. I'm like, "How about these veggie skeletons? They can, like, build them themselves, and the head is like the ranch dip," and it was interesting because, I got my partner's Primal Kitchen on board for that, and, well, I'm gonna cut up a bunch of veggies on the 30th before this party, but it's like they're still gonna have the candy, they're doing like an orange rice crispy treat pumpkin, like they're molding it themselves. Okay, cool. Like they're gonna get these little sweet things or treats too, but how can we kind of like add those antioxidants, fight that
Yeah.
inflammation, get them used to those healthy foods? It's all those baby steps you're talking about. Okay, so let's jump into we talked a little bit about supplements in regards to like hydrolyzed collagen being a supplement you recommend. You mentioned vitamin C. Are there any supplements, whether we take them internally or skin supplements, that you recommend that people use?
Well, definitely, one of the things we mentioned with vitamin C is an antioxidant that ideally we want to put not only in our bodies, but on top of our skin as well. And so the whole idea of autojuvenation is not just what you put in your mouth. And so if you ask a holistic health doctor, you'll say, hey, how do I get beautiful skin? They'll say, we got to improve your gut. Let's get your gut doing well.
Yeah.
If you ask a dermatologist, hey, how do I get beautiful skin? They'll say, put sunblock on and use a retinol. If you
Yeah.
ask a plastic surgeon, they'll say, get a facelift.
Yeah.
And really, the way I look at it with autojuvenation, it's a combination of the best, ideally, of holistic health, which is healing your gut and really getting you young on the inside with treating your outside too. there have been studies that actually have looked at people and found when you look actually at identical twins, and the identical twins, the one that actually has less sun damage, the one that seems to look younger because they've had a different lifestyle, often will live longer than the one that doesn't look as young. So the actual how you look, interestingly enough, can impact in ways we don't quite understand our longevity.
Mm.
So really then the idea is, okay, we talk a little bit about what you put in your mouth, but what can you put then on your skin to get young, healthy skin as that part of autojuvenation? And I would argue that you don't have to buy a ton of skincare products. You don't have to do a 12-step Korean skincare routine. You can make it very, very simple. And we tested this out on people. So in the morning, you start with a cleanser appropriate for your skin type. If
Mhm.
you've got oily skin, then you want to use a foaming cleanser because that may help reduce some of the oil. If you've got dry skin or real sensitive skin, then a more milky or hydrating cleanser can be better. After you cleanse your skin, apply an antioxidant serum like vitamin C. And here's a tip: if you can find one that contains vitamin C and vitamin E together, those vitamins are synergistic when used together on the skin.
Okay.
There was a study that looked at that and found the antioxidant abilities of those two combined is synergistic than if you use them separately. And then I recommend wearing a sunscreen, at least in SPF 30. Now, sunscreen, hot topic. Dermatologists will tell you if you're living in a basement all day, apply your sunscreen.
Yeah.
And holistic health experts will say, it is therapeutic to get sun on your face in the morning. You need sun for vitamin D. What should you do? Well, as a plastic surgeon, I have seen so many people who come to my office with skin cancer on their face. And you do not want to get skin cancer on your face. I've had
Mhm.
patients come in and go, I've got a little dot here. And I say, well, why don't I send you to the dermatologist? And when they get Mohs surgery and then they come back to see me and half their nostril is gone, or they've got a huge, huge hole in the middle of their cheek, it
Mhm.
is devastating. So the first thing you really want to do is you do not want to get skin cancer of your face.
Mhm.
That being said, I also understand that it is so therapeutic, especially I live in Detroit. And man, in February, when it's just gray and the sun comes out one day, it is so therapeutic to get that on your face and to feel it. So I think, like anything in life, there is a happy medium there somewhere.
Mhm.
If you're going to be inside all day, do you have to put your sunscreen on? Probably not. If you're in a car all day, then you should, because the car windows will block UVB rays. So you won't get burned, but you can still get the sun damage from the UVA rays that can cause skin cancer and premature aging.
Mhm.
So long answer to the sunscreen question. So usually recommend a sunscreen at least SPF 30, especially if you're going to be out during the day. If you're going to be inside all day and you want to avoid that, then that's up to you. And that's all you have to do in the morning.
So,
Cleanse, vitamin C, sunscreen.
sunscreen, mineral based, or like, how do you feel about just a zinc oxide?
So yeah, that's also a big question. So dermatologists will tell you that all sunscreens are fine, just use them. And then there are people online who will say, don't use any sunscreen, it causes cancer. What is the truth? Okay, so what you have to do is you have to look at there is a difference between sunscreen and sunblock. Sunscreen, sunscreens are chemical sunscreens where basically the chemical absorbs into your skin, maybe into your bloodstream, and then there's a chemical reaction that it can neutralize basically the UV damage that's caused by the sun. Sunblock, like zinc oxide and titanium dioxide, sits on the surface of your skin and blocks the sun's rays. Ideally, everybody would use just sunblocks because
Mm.
we know that doesn't get absorbed into your skin and your bloodstream. But the problem with sunblocks is that they can make your skin look white. Now,
Mhm.
if you have very light colored skin, then maybe you do fine with it. But if you're African American, if you're Indian, if you're Asian, then you may find that you don't like that white hue on your skin. So then what do you do? Well, there are certain sunscreens that I definitely recommend you avoid. And the two big ones are oxybenzone and octinoxate. These
Okay.
two are known to be potential hormone disruptors, and they're believed to potentially cause damage to the coral reefs. So if you go to Hawaii or you go to the Caribbean, they may not even let you wear it anyway. But there
Mhm.
are other sunscreens like avobenzone, agmexoryl XL. Those actually do appear to be very safe.
Mhm.
So then what do I recommend? Okay, if you have children, ideally just go with the mineral-based sunblocks.
Mhm.
My kids, when they were your kids' age and we were at the beach, they did not care that they had this white pasty stuff over their skin. They're just happy jumping into the water. And the
Right.
worst thing you can do is take a chemical sunscreen spray and spray it all over them because they're breathing those particles into their lungs, and that's not what you want.
Yeah.
As an adult, what I usually recommend is if you say, hey, look, I don't want my face to be looking different, then I would recommend a chemical-based sunscreen, either Mexoryl or with avobenzone. Just avoid oxybenzone and octinoxate. Put that on your face. That's going to be oftentimes thinner as well and feel more comfortable. And then
Mhm.
for the body, ideally use a mineral-based sunblock.
Perfect. That's a great happy medium. And I love that you mentioned the spray sunscreens because there's so often where I just see
Yeah.
people going at it, and if we're like in their shot, we're like, I
And you
pick
can
up my
smell it.
kids and I'm
You
running
can breathe it.
away
Yeah.
like a crazy person because I just,
And
it's
if
like it
you,
gets everywhere. It's never even on their
yeah.
body.
And if you've got it at home, you're like, well, I don't want to throw it in the garbage. Just spray it in your hand and then wipe it on your child. And that way you can still use it.
There you
That's why
go.
sometimes we have that. I've got a beach house and sometimes, people bring that over and we just say, hey, just spray it in your hand and then just apply it. And that works just fine.
Okay, so that's our morning routine. We're
Yes.
using the sunblock over sunscreen when we can. And so what's the evening look like?
So the evening is so important to start by cleansing your skin because your skin can really get the buildup of the day's worth of grime, dust, pollution. If you've got makeup, we usually recommend a double cleanse. So an oil-based cleanser. So there are literally oil cleansers out there that are great for removing makeup. So you start off with that, and then you do a regular cleanse afterwards. If you don't wear makeup, then you could probably just get by with just a regular cleanse. And then after that, you want to apply an anti-aging cream. Now, there are three types of creams that I would recommend you consider. The first type is the one that is kind of like the gold standard, and that would be a retinoid.
Mhm.
Retinoids are derivatives of vitamin A. Prescription strength is retin A or tretinoin, and non-prescription strength are retinols. Most big skincare companies have a retinol cream that's not very expensive. And if you were to pick one anti-aging cream, then that's the one that I would recommend. But
Mhm.
the problem with retinols is that they can be kind of hard on your skin. If you've got
Mhm.
real sensitive skin, it can cause irritation and redness. Sometimes it goes away within a couple months, other times it doesn't. If that's the case, then you may want to try a bakuchiol-based cream. Bakuchiol was shown in a study, it was compared head to head with retinol and found to have very similar anti-aging properties, but
Mhm.
much less irritation. And
Mhm.
bakuchiol is basically, it's a compound made from the bobchi plant, and this has been used in Ayurveda and Chinese medicine for centuries. Now it's a very hot ingredient for skincare products. And then the other two, if you don't have access to bakuchiol or retinol, then there are growth factors and peptide-based type creams that I think are very reasonable. Problem with growth factor creams, very expensive. Problem with peptide-based creams, maybe not quite as effective as bakuchiol or retinol.
Mhm.
And that's all you have to do at night. Cleanse your skin, apply the anti-aging cream, whether it's a retinol or a bakuchiol. And then if you want, you feel free to apply a moisturizer on top of it.
Mhm.
Moisturizers, people believe that if you apply moisturizer to your skin regularly, it's going to slow down the aging process. And that is just false.
Mhm.
Moisturizers are great for feeling moisturized, for plumping the skin up temporarily, but it will not do anything to the actual aging process.
Got
So
it.
you don't have to have it. If you, let's say, are in a really warm climate and you've got kind of oily skin, do you have to use a moisturizer? No. If you don't need it, then don't use it. If you're living here like I am in Detroit and it's in February and it's dry as heck, then feel free to use that moisturizer. And then the final thing is maybe 2 times a week, once a week, if you have sensitive skin, try to exfoliate your skin, get rid of that upper layer of dead skin cells, either by doing a gentle scrub or by an alpha hydroxy acid type of a peel. And the idea behind exfoliation is if you get rid of that upper layer of dead skin cells, it will actually send a cellular signal to the deeper layers of skin cells to turn over more quickly. And we do know that our skin turns over more slowly as we get older, and that's one reason why we kind of have rough skin afterwards. And so this can kind of get that process revved up.
That was such a great roundup. I actually, I have a free skincare guide that mentions bakuchiol and
Ah,
retinols and all of the chemical based like alpha hydroxy acids that I've used and loved. So if anyone wants to check that out, or I don't know if you have any specific brands that you recommend, I've tried a lot, so I
yeah.
did a roundup of my favorites.
Well, I have my own brand called Youn Beauty because I found that, as a plastic surgeon in traditional practice, I carried a lot of these medical grade skincare brands and they
Right.
really work. Like they were aggressive and I'd see these great changes in people's skin. But the one secret I had that I never told anybody is that I couldn't use them myself. Because if I would apply it to my skin would, I get hives and my skin would get irritated. And so I, for years, just used the mildest cleanser and the mildest moisturizer, and that was it. And then I started getting into holistic medicine, and I started trying some people's skincare lines that were all made with natural and organic ingredients, and I could apply that to my skin and be fine. So I thought, okay, the problem with the one group is that there's all these additives and preservatives and fragrances and stuff, and it does work, but it's not good for your skin necessarily. And then there's the other group where, man, it feels great on my skin, but doesn't do anything.
Yeah.
So I created my own brand that kind of combined the two, and we call it Youn Beauty. And
Oh,
that's the idea, is to kind of get medical grade ingredients, but with natural and organic components too. So
I love that. That is, I mean, I think you hit the nail on the head. There's just, there's definitely a need for that medical grade efficacy without all of the fillers and preservatives and fragrances and all of it. I think people were looking for efficacious and did it feel good, but it wasn't really
yeah,
looking at the ingredients in the same sort of light.
and that was what I found, and that's why I thought, geez, if nobody's making this, then why don't why don't I just do it?
Yeah.
And so that's what we have. So it's made with natural and organic ingredients, but it's got retinol, we've got kojic acid and vitamin C and vitamin E and all that. And so it's really been very successful for us.
That's awesome. Yeah, I remember being put on retinol from my dermatologist when I was in my 20s, and
Mhm.
it was a disaster. Like I
Uh,
just was bright red, and I couldn't get rid of it, and it was peeling. And I just think that the percentage was just way too high for my skin at the time, and I spent too much time outside. That just it
mhm.
my skin couldn't get a break. You know?
That that's the same thing that happened to me, honestly, when I was in residency, just starting, and I was having some adult acne issues, and my wife, girlfriend at the time, was having the same thing. So we went to our family doctor, and she had real oily, thick skin, and she said, I do great with this Retin-A. Let me prescribe it to you. I'm like, oh, okay, sure. And she said,
Yeah.
just apply it every day. And
Oh
I started
yikes.
applying this 0.1%. I started applying it to my skin every day. And here I'm a plastic surgery resident, for God's sakes. Like, I should know
Yeah.
better than this, but we were never taught this stuff.
Right.
And I saw my wife, girlfriend at the time, a week later, and we both started laughing at each other because both of our faces were bright red. They were like flaking, and we're just like, it's the same thing happening to you.
Yeah.
And the thing is my doctor had really oily, thick skin. And so for that type of skin, then stronger retinol, like Retin-A, can work really well. But skin
Right.
like mine, skin like yours, my wife's, man, it's a horrible dermatitis that you can get. And so starting real slow with an over-the-counter retinol, if you want to try that, that's what I usually recommend for people. Don't go straight to the dermatologist, or God forbid your family doctor, who may not know what they're prescribing, because it could be too strong.
Right, and but you want those benefits of maybe cell turnover and that look of rejuvenation that retinol can provide. That's a great tip. Now, that leads me to my next question, which are more along the lines of like lifestyle things that we can do, whether that's specific types of in-office things like
Mhm.
lasers. You mentioned exfoliating once a week or so, but when we look at the medical grade things that we can start doing, how do you feel about things like Fraxel and IPL and all of those type of like cellular rejuvenating lasers?
A lot of them really work, but it's going to be picking and choosing what you use. The first thing you have to keep in mind is that if all you have is a hammer, everything looks like a nail. So there are offices, family docs' offices, plastic surgeons' offices, where they will literally buy one device and they'll
Mhm,
recommend it for everybody. So the first thing you want to do, if you're thinking about taking that step beyond just skincare and and taking good care of your diet and all of that, is to make sure that you research whatever procedure you have. If you are somebody who says, hey, I just want to dip my toe in the water and try technology and see if it can help my skin, then the first thing I would recommend would be red light therapy.
mhm,
Red light therapy is something very hot in the holistic space, not really talked about in traditional dermatology and plastic surgery. And it wasn't anything we talked about until I got into more of the holistic space. I started researching it. There are a lot of devices out there, from handheld devices that you can kind of target a quarter of your face at a time, to tabletop devices, to actual red light beds that you can get in. And we believe that red light helps to rejuvenate the skin by stimulating mitochondria and energy in the mitochondria. And so it's kind of a vague way to believe what's going on with it. We don't otherwise really understand how it rejuvenates the skin, but there are many, many studies that actually do show it does improve the skin. So it can help with the collagen of the skin. It can help with dark spots. It can help with fine lines. We just are still figuring out why it works that way. The
mhm.
good thing about red light therapy is it's completely safe. You can do it at home. And so that's always the first place to start. The second thing that I would recommend at home that really works well for people is dermaplaning. Dermaplaning is a treatment that we do in the office where we actually use a specialized blade, and it's literally kind of like shaving your face with a blade, where you get rid of that upper villus hairs. That's kind of the little light non-colored hairs that you have, but it can also help to get rid of that upper layer of dead skin as a kind of an exfoliation. There are devices that you can buy that will do it. Like there's one called Smooth Shape, I think. And but there are also these little blades that you can just buy on Amazon that can do the same thing. And you do that, and your skin can feel real soft afterwards. After that, though, the next step would be going into an office setting. And the first thing that I recommend, especially you mentioned earlier that you had some potential issues with spots, IPL is a great option. IPL stands for intense pulse light, and this is uses light energy to target pigment in the skin to destroy the pigment, and then that pigment basically sloughs off within about a week or so. Reason why I'm a big fan of IPL is number one, it's like doesn't hardly have any pain associated with it. Super easy to undergo. Number two, it's not that expensive, especially compared to something like Fraxel.
Mhm.
You can do it for maybe a couple $100 a treatment. And then
Mhm.
third thing, it's chemical free. Okay, so if you're living a really healthy, clean lifestyle, there is zero chemicals. It's literally just light energy and your face, and so it really works well for that. You can literally see results after one treatment. A week later, those spots start to slough off, although most people require several treatments for optimal results.
Yeah, no, I'm a huge fan of IPL. I've been doing it
Oh, good.
since prior to my wedding, and Chris and I have been married for almost 11 years, so a long, long time.
Yeah.
But I really see a benefit, especially because I do have those brown spots. Now, what's the difference between that and something like a Fraxel?
So the old-fashioned lasers are called the ablative lasers, and basically lasers work by targeting a color of the spectrum. And the color that certain lasers that work like Fraxel will focus on is literally the color of water. So we kind of think like water doesn't have color; it's clear, but technically there is a color in the spectrum. We just can't see it. And
Mm,
so really with the old-fashioned lasers, what they would do, the old-fashioned CO2 lasers, is that they would literally burn all the skin off your face down to a certain layer of the dermis, which is a deeper skin. And by burning all the skin off your face, number one, it exfoliates the upper layer of skin. So as it grows back in a tighter fashion. But number two, you deposit heat into that deeper skin. That heat then causes the collagen to tighten up. So the way I describe it is the collagen of our skin, once again, 70 to 80% of our skin is composed of collagen. They're like the logs of a log cabin. And as we get older, those logs get kind of frayed, they start to fall apart. And interestingly enough, one thing that can cause that to get worse is sugar by glycation. So you eat sugar, the sugar molecules will bond to the collagen fibers and create what are called advanced glycation end products, or AGEs. And that can cause those logs, that log cabin, to stay permanently kinked so that now your skin has been permanently damaged and premature aged. So really what these lasers then do is that they heat those logs, they cause the logs to kind of fall apart. And then when they heal together, they heal in a tighter fashion. And that's how all the laser treatments, technically, radio frequency, ultrasound, all these technological treatments work to tighten the skin by heating the deep skin. So the old fashioned lasers did it by burning the skin all the way from the top down. Fractional lasers do it by doing the same thing, but only burning a fraction of the skin. So when they say it's pixelated or fractionated, it's instead of burning everything down, it's burning tiny little columns of the skin. And that way it heals faster, but it all works the same way. Those are more expensive. And if you're looking for tighter skin, for some rejuvenation of kind of the surface of the skin, then that can work, but that also is more downtime and a lot more expensive.
right. Well, I love it. It's like you took me to laser school, and I think a lot of people have questions around this because yeah, you even see, I can't remember what it's called, but the micro needling
Yeah.
facial. I think they called it a vampire facial, but where they, that same sort of a thing where they're creating damage to the skin so that the collagen can heal and tighten or plump or whatever the case may be. How do you feel
And
about those?
so really, if you were to say, hey, Dr. Youn, what are the two best bangs for your buck as far as treatments in an office for me? Then number one, I would say would be IPL. And number
Yeah.
two, you are so on the right track, is microneedling. So microneedling, basically, we know what dermal rollers are. There's those rollers that you roll on your skin, and dermatologists and doctors typically aren't big fans of those. And the main reason why is that because when you roll the skin, what you're doing is you're creating tiny little punctures in the skin
Mhm.
with tiny needles on that roller. But because it rolls your skin, the punctures can be uneven and they can even cause tearing. So what
Mhm.
we're more a fan of is stamping of the skin.
Mhm.
One thing I'm doing for my hair is I'm actually regularly stamping my hair with a stamper with tiny little needles on it. And the idea behind that is you're creating damage to the collagen of the skin. And if the collagen is damaged to a certain amount, it can cause, once again, the collagen, the logs in that log cabin, when it heals, to heal in a tighter fashion. If you damage it too much, you create a scar. Okay, so you don't
Right.
want to go that far. But if you do some mild damage to it, then it heals in a tighter fashion. And that's what microneedling does, is you're making tiny little pokes in the skin, hundreds if not thousands of them, and the skin heals better afterwards. Now, when you make the poke in the skin, you're creating a little hole in the skin, and it can actually be used as a channel through which, if you apply something on the surface of the skin, it can seep into that channel and affect the inner skin. Does that make sense?
Yeah.
And so the idea behind PRP, or the vampire facial, is you draw some blood and your blood is chock full of platelets. Platelets are chock full of growth factors. You put the growth factor, you microneedle the skin, you have all these tiny little channels in your skin, these tiny holes. Then you apply the PRP on top of it. Now those growth factors will seep into those holes and will rejuvenate your skin from the inside out. Once again, this is autojuvenation at work. It's your body's own regenerative abilities causing you to look younger. So that's, if I had to pick, like I said, the two best bangs for your buck: IPL, because it's a great way to get rid of spots. And then if you're looking at just overall facial rejuvenation, microneedling, not that expensive. It costs us about $3,000 to buy a microneedling pen. It costs us $100,000 to buy a laser. Okay. So those
Wow.
costs of the device are pushed onto the patient.
Right.
So microneedling, not that expensive. PRP adds a little more cost to it. And then if you want to take that to the next level, then that's where we do a treatment called Morpheus 8. Morpheus 8 is radio frequency microneedling, where the needle goes in, and once it hits the end, it emits radio frequency energy at the tip of that needle to heat the deeper skin. And what does heat in the deeper skin do? It causes it to tighten. So that's the other thing.
So cool. I love learning from you, Dr. Yoon. Thank you so
Oh,
much.
thank
This
you.
is definitely the lasers and facials wouldn't be my expertise at all. I kind of play in the food and blood sugar balance, gut health sort of scene, but it is, as I age and as I'm tap experts like yourself to help me understand the information, I then can make and my audience can make those informed decisions around what's best for them so that they don't have to end up on your table, so that they can really allow their body's healing mechanisms to and that autojuvenation to happen so that they can take care of themselves. So thank you so much for being here and sharing all your knowledge,
Thank you, Kelly.
and congratulations on your new book. It was a great read. I'm so excited for you. It's gonna slay in the new year.
I
So
appreciate it.
yeah. So where can people follow along now though, before, and when does it come out for pre-order? Where are you on the socials? All the good stuff.
So yeah, I'm huge on social media. You can find me anywhere. Just look for Dr. Youn. The book actually is autojuvenation.com. For people who pre-order or order the book, we have a ton of free gifts, including a free gift certificate to our online store. So if you're thinking about skincare products, that's a great place to go. And we'll give you, actually, if you buy the book, we'll give you that amount, $30. You may actually buy it for less, as a gift certificate for the online store for skincare for free then too. So, but autojuvenation.com is a place to go for all the stuff if you're looking for that.
I love it. Congratulations, Tony. I'm so excited for you, and it'll be really fun to watch the journey of your book being released and everyone getting their hands on it. So congratulations, and thank you for
Thank you,
being a
Kelly.
guest.
Thank you so much for having me on. This was a lot of fun.
It was.